Okay. Hello, everyone. I'm Dr. Nikita Chattai, and I'm the course director for our next online mammography bootcamp with artificial intelligence 2023. So this is a small introductory and welcome video. So first of all, I would like to welcome and congratulate each one of you who have decided to join this online mammography bootcamp with AI. This is our third of its kind online mammography bootcamp. We have done a couple last year with a great success, and there were a lot of inquiries, so we decided to do one more this time. So in this online mammography bootcamp, it's very different and unique because it's an intense and rigorous way of uh, taking the participants through 100 plus cases of mammogram with AI, by allowing them to be still continuing to do their work in the daytime during their office hours, and then join the live session over weekend. And at the same time, for one full month, you all will have access to the cases which are uploaded on a dedicated web-based platform. So let me just share some details about this bootcamp, and also in the later part take you through this platform to share with you how to use the platform, the details of which have been sent to you today. So starting with this, all right. So first of all, I would like to thank Lunit for supporting us for this mammography bootcamp. You will see that we have provided you with artificial intelligence cases in all 100 plus cases having the Lunit image. So this bootcamp is going to run from 27th of May, that's today, all the way till for 1 month till 26th of June. And this time, I'm happy to also have two of our other faculties, Dr. Teresa Bunaflor from Philippines and Dr. Merit El Madawi from Cairo University, who are joining us. And we have a guest speaker, Dr. Rasha Kamal, who is a senior consultant and associate professor in Cairo University and doing a great work with contrast enhanced mammogram. So Dr. Rasha on the last day is going to be is going to be sharing beautiful cases of contrast enhanced mammogram, and myself, Teresa, and Merit will take you through the other mammography cases over next 3 weekends during the live sessions. So I'm sure you all have heard about this word bootcamp, which is generally used for new recruits in military training camps, which actually is a very short but intensive and rigorous training, which is associated with harsh discipline. Through this harsh training, uh, severe workouts are done by the new recruits so that they get trained very nicely into the work which they're supposed to be doing in future. And this is what we are going to be doing. This next 1 month of training is quite intensive because there are a lot of cases which we expect you to go through the cases, each case, jot down their findings on your own with a lot of discipline. And every weekend we will discuss them live with you, come up with your questions, get your doubts clarified, and go back with your enhanced knowledge. Right? To make it a little more comfortable for each one of us, we have made it, instead of short, we have spread it out over 1 month so that you have enough time to go through the cases now and also at the end of 3 live sessions to revisit them. And so you will get to learn the each case and the learning from each case very nicely. So what are the objectives? So in this hands-on experience of mammography reporting with AI, we really expect that each one of you enhance your perceptive skill. Now, looking at the mammogram and analyzing the mammographic images and to find abnormal features and to differentiate it from a normal finding is what we call perception. We all know that almost 50% of the missed cancers are because of the perception abnormal or perception errors. They are so small probably, or they are so hidden that they may be sometimes missed by the reporting radiologist. And by doing this hands-on exercise, we are looking forward to achieve an improved perception skill by the attendees, and this in turn will help for better cancer detection and accuracy in your clinical practice. Once we have found an abnormal finding, then what is next is to interpret it correctly. Half of the missed cancers are due to interpretation errors, and that means that the abnormal finding was actually perceived, it was detected, but it was not interpreted correctly, and the decision was made to let it go, probably thinking it as a benign finding. And by going through this hands-on experience over 100 plus cases, we hope that with the expert guidance, we will also help you to improve your interpretative skills. And thus, together with improved perception, you will be able to perform better in your mammography reporting, especially to detect small cancers. Now, this is one of the very important part and unique feature of this bootcamp is introduction to artificial intelligence in mammogram. AI is no more a new term to each one of us, and we all know that it is coming at very fast speed and entering our medical field, including radiology and breast imaging. We cannot not learn AI because we all have heard that radiologists who do not use AI will be replaced by radiologists who use AI. We need to learn and embrace and strengthen ourselves by including AI in our reporting, and together as a team we would be able to perform better. So in this mammography bootcamp, you all will get to see all cases with AI inputs and learn the strength as well as limitation of AI. We will encourage each one of you to report every single case when you go through them and find a abnormal finding to report it with appropriate BIEDX lexicon. And by doing so, when you prepare the reports will come out of the international standards, and this will overall help in better diagnosis and management of our breast care patients or our breast cancer patients. How is the outline? There are about 100 plus mammography cases, each with AI inputs. These are cases which are mixed from screening, diagnostic, as well as surveillance studies. The all cases you will have AI image inside. So I would encourage you to first just go through the 4 standard images, make up your mind, look for the abnormal findings. And once you have made up your mind with standard images, after that, go through the AI and then see whether you would want to change your finding or you would want to agree with AI. And thus you will see how AI helps you to do better or to perform better by increasing your sensitivity or specificity while you are doing your mammography reporting. So the cases will be with you so you will have access to the cases over next 4 weeks. And today, each one of you are going to be receiving an dedicated account for each one of you. So a particular URL to access the web-based platform with your account details has been sent to you. I would say that once you get the details, go through open the web-based platform, open some cases, and initially maybe for half an hour or so, just play through the tools and get yourself familiarized with the various important tools to be used during mammography reporting. After that, you can go through 2 sets for every week. So totally there are 6 sets. Cases are divided into 6 sets, each set with about 15 cases, and last 10 cases will be separately on CSM or contrast enhanced mammogram. So for first week, go through test set 1 and 2 in this coming week. Next Saturday, when we will see you in the first live session on 3rd June, which will be from 2 p.m. to 6 p.m. Singapore time. Please remember to adjust your own country time accordingly. That day, there will be live session to discuss all 30 cases by Dr. Merit and Dr. Teresa with you through this session. They will take every single case and then discuss with each one of you the findings and how to report them, what is the correct lexicon, what is the next test to be done, what would be the correct buy rates. Everything will be discussed in that live session. In the beginning, we will have a talk on approach to mammogram, and at the end of the case discussion, we will have a short talk on introduction of artificial intelligence in breast imaging on 3rd June. In the week 2, you can go through cases from folder 3 and 4. There will be next case 30 cases. And on second week, second live discussion on 10th of June, Saturday, again, same time, we will begin with a talk on learning from mistakes while doing mammography reporting. Then we will have a full 2 hours or 2.5 hours of discussion of cases. We will take almost 3 hours of actually discussion to take you through 30 cases from test set 3 and 4. And then at the end, we will have a talk on AI in DBT, which is the next new thing coming in the market. Week 3, we would request you to go through the last 2 folders, that is test set 5 and 6 with next 30 cases. And the last live session on 17th June, we will start with first 10 cases of contrast enhanced mammogram, especially by our guest speaker, Dr. Rasha Kamal. And then we will have discussion on cases on test set 5 and test set 6. That day, we will again spend extra time. If you have any questions related to any of the cases discussed or any other queries related to mammogram, do not hesitate to reach out to us. Honestly, I would say that every week when you have gone through your cases, please put down your findings on some paper or notebook. And when we are discussing the same cases during the live session, go through your answers, see how you were doing before. If you have any questions, get it clarified right away. And this way, you will make the best out of this. Like this, in first 3 weeks, at the end of 3 weeks, that is on the 17th June, we would have finished going through all 100 cases. And then you will receive the now answer sheet for all 100 cases. And from 17th June to 26th June, almost for next 10 days, you will continue to have access to all cases along with their answer sheet. And we would encourage you to revisit all these 100 cases with answer sheets. And if you have any further queries, you can always email back to us, check answers with us, get your doubts clarified, so that by the end of this entire bootcamp, you probably would have grown in your journey of breast imaging reporting and understanding the role of AI and contrast enhanced mammogram in breast imaging. We are hoping that through this, you will have a great experience. The team has worked very hard along with the faculties to provide you a unique ID and password and dedicated platform for each one of you. We all know that mammography cases are best seen on high resolution medical monitors, but we understand that that may not be the possible case in each one of you when we are going through these cases. So in case if you do not have access to medical monitors when you are reviewing these cases, try to use good size laptop or desktop. And you will also need to use the mouse. I will show you why, but you will also need to have separate mouse while using some of the tools on this platform. Try to make the lights around you dim. Try to go through the cases in quiet surrounding with full concentration. Go through each case very diligently. Once you have got yourself familiarized with the e-learning platform, start solving the cases as and time permit. I would recommend that every week you sit for at least a couple of hours on at least 1 or 2 days to go through the 30 cases of that week, which are going to be discussed, and be prepared with your answers and queries so that you can get the best outcome on Saturday when we discuss those 30 cases. Use all the tools which are required to review every case diligently. There will be some cases where we have also provided you with the prior studies. So compare with them very diligently and look for small changes to find small cancers. Adjust contrast whenever required, and remember to digitally magnify every single image and every single case, because that is where the money lies. Keep your findings in a note and use the BIEDX card handy. We are also going to send you the soft copy of the BIEDX card so that you will be able to apply the appropriate lexicon for every single case. And after these 100 cases, it should become a second habit to you to use appropriate lexicon for every single mammography reporting. Complete the test set in given time frames, so that every test, every 2 folders you should finish for every week when we are going to discuss before we come to those live discussions. And that will help you to get the maximum benefit of learning through this bootcamp. The key features are that there are a large number of cases which are mixed from screening, diagnostic, and surveillance. And this is going to give you an experience of hands-on experience of learning mammography sitting in the comfort of your home. There will be ample opportunity for each one of you to interact during live sessions. So do not be shy. Even if you do not want to, you don't have to speak, you just have to put your questions or queries in the chat box or Q&A session and get your doubts clarified. Never think that this may look very stupid questions. There are no questions which are stupid. Remember that every doubt is important to get clarified, and this is the best opportunity for each one of you to get your doubts clarified and learn appropriately. You will also get exposure to contrast enhanced mammogram and AI, which are the new futuristic thing in breast imaging, and that is a different edge for this bootcamp. At the end, you will all receive the certificate of completion from Breast Imaging Essentials. So I hope that you enjoy the bootcamp and make the best out of it. I would like to thank each one of you for participating in this. And also I would again like to thank Lulit for their support. Now I'm going to take you through a small quick demonstration of the platform. So in your email today, you all would have received the URL to access the platform. Copy paste that and use the Google Chrome. Chrome works very well with this. Use your own user ID and password to open the platform, and then each set of folders have a particular test ID. So just try and copy paste each one. I will show you how. And every week you are expected to go through 2 folders. So like this, in next 3 weeks, you will finish off the 6 folders. Okay. So what we are going to do is that we are going to copy paste the URL first. Okay. Okay, so let me first stop sharing and then now start sharing the screen. All right. So now when you go into your Google Chrome, open a new window, put the URL and enter. Once you enter, particular username and ID are already provided to you. So once you put that, you will be able to log into your account. When you log into your account, because you are logging it for the first time, this whole thing is going to be blank. Okay. So next thing what you are going to do is that use the test ID for folder number 1. Suppose if you want to go through the folder number 1, you're going to copy this entire test ID, and then you are going to be putting it here into the enter test ID and then enter test set. As soon as you put, now you will have the access to the cases which are included into test set 1 or folder 1. You see here that there are 19 studies here. Why? Because this patient, there are 15 cases in this folder and 4 of them have prior. So you will see here prior. So if there are 4 cases which also have their comparison from prior studies. So totally there are 19 studies, and you are going to be reporting 15 patients from this. Okay. So once you have this list, what I generally do is that I just select maybe about 10 studies in the beginning. And once you have clicked them, by clicking in this square box, click on what is written as add to prefetch. By doing this, the studies will be prefetched and kept ready in your cache memory, so that when you want to open them, it will be easy. Otherwise, if you start fetching one by one, sometime what happens that it may take a time, it takes some extra time and it might delay your reporting. Okay. So I've already selected about 10 of them and how put for prefetching. So now I'm going to be clicking one study at a time, open it, and then report it or go through the findings. Okay. Now the first case one has prior also. So I will select both of them and click on the first button, which writes diagnostic viewer. Okay. So now once you click the diagnostic viewer opens. The first thing what you want to do in the diagnostic viewer is click on this button which says enlarge viewer to use the full screen. So when I click on this, the entire screen gets occupied, and this is going to maximize the utilization of the screen. All right. Now there are 4 images loaded here. In case if you do not have any cases loaded, you can always decide what kind of grid or protocol you want to use. Generally, I start with 4 like this, and you may want to pull your cases here one by one and then load them if required. Okay. So generally, whenever I generally start by grid, which is 2 by 2, and I can always put them side by side and then go through to get an overview of the study and then go into every view separately, right? So once I have put them together, probably it might be a good idea to remove these annotations to get a screen better. So this button which shows this man with these annotations, when we click on that, it says overlay off and on. So when I click on it, now the overlay is off. If I want to see it again, I can click it one more time, and this is going to show me case number and patient's age. Okay. So I put it off now. And now I want to keep the images next to each other, close to each other, how we are usually using in our clinical practice. So I can click on pan and then try to bring them together. So you see here, there is a pan button here. So when you use pan, you can use pan and bring them together to get an overview of these 4 standard views, right? In case if you want to mag these images, generally I have seen that the mag button given here does not work well by clicking here. If you want to mag any study, you have to use your mouse and use the right and left click on the mouse button together. Okay, so use both right and left together, and when you click them together, you will be able to use the function of zoom. If I want to use zoom on this, I will click right and left together and then use your mouse. And after using the zoom, your left click button automatically becomes pan. Okay, so together the 2 buttons right and left does helps you to zoom in and zoom out. And after the function of zoom, the left button automatically selects or becomes pan. Okay. Okay. Similarly, if I want to zoom in and zoom out, I'm going to do right and left button together, and then I can use pan after using the zoom. So like this, I can adjust the zoom and pan depending on my need. If you want to change the contrast, you can use the right button on the mouse, and that helps to change the contrast of the images. So use the right button on the mouse, and see, these are all important functions for which you are going to require mouse. So even if you're using laptop, don't try to use only the click on the pad, touchpad, which we generally use. For this platform, you will require an attached physical mouse. Okay. So you will have to attach and use the mouse. Okay. So once you have again zoom the images, pan it, keep them together and get an overview of this study. All right. Once you have done this, I would generally want to go into the hanging protocol of 2 so that I can now have a better evaluation of this entire images. The best practice is to zoom it in such a way that you try and utilize the most part of the screen together, and don't keep it very small. Try and zoom it quite big, quite nice. Obviously not too much zoom so that it starts pixeling. And then from top to bottom, start from the top and go in a zigzag fashion or Z fashion from right side to left side. Go from skin towards the chest wall, go from skin towards the chest wall. And like this, your eyes have to move in a zigzag fashion from top to bottom, from skin to the chest wall, covering entire breast image properly. And this also allows comparison while you are screening through the two breasts very meticulously to find any small abnormal finding or abnormality. Okay, so you go through the entire image going from top to bottom and from skin to the chest wall. And once you have finished going through the one view, you can use the just use the center of the scroll button, and that allows you the center part of the center scroll button of the mouse allows you to scroll through the images. Sometimes on Apple machine or sorry, on Apple laptops or desktop, it might be very fast when you use the central part. In that case, you can always use the less and more than buttons on your keypad to also go through the images. So now I'm just using more than and less than buttons on the keypad to scroll through the images. So now you have scrolled through the images. Now you are going through the CC images. Again, same thing. Go from top to bottom, from periphery to the center, compare on the two sides, and then make up your finding. Okay, make up your mind for what is the abnormal finding. Now, this patient, as I mentioned to you before, has a previous study. So what I'm going to be doing is that I will bring the previous study here next to it so that now I can keep them next to each other and can compare. So in case if you are not very clear, always go back with the annotations. And this is going to show you that this is case number 1 and this is case 1 prior, right? So now I'm very sure that this is a prior study. Another way to know which is the prior and which is current is the current study which we are reporting is lined. That box is lined by green here, while the prior is lined by yellow color box. Okay, so that is also one of the ways you can compare that the study which is outlined or the box which is lined by yellow is a prior study. Okay, so now I have right CC from now, right CC from previous. Next, I'm going to go to the next button and see if I can see the MLO view. So now I will go through the MLO view on this case. And okay, so see now it is got stuck. Sometime if it gets stuck, don't worry. Either you just press F5 or pull the image again. Okay, so I pull the image again, confirm that this is the green box. So this is the correct image, and now go through them each by each part to each part. Okay, now going back to the left side of this breast, bring it here, go to the left part, bring it here, check with each side, and go to the left CC last part, and then compare them from now to prior. I'm sure all of you would have noticed that there is an asymmetry identified in the outer half of the left breast. But what I see here, that this is stable from before. This is almost 2 years old mammogram. If you see here 53 years old, 55 years old, so this is about 2 years different mammogram, and this asymmetry has remained stable. It means that this is most likely a benign asymmetric breast tissue, right? So once you have gone through the cases, the main functions what generally we use is that, so if in case if it gets stuck or if you want to go back to reset, just press F5. When you press F5, everything gets reset, goes back to normal, and you will have to start utilizing the entire diagnostic viewer again. Okay, so just go through anytime you want to reset, anything gets stuck, always go back to F5. Now, once you have analyzed the 4 images, made your mind already with the findings, I would say now pull the 5th image, and that is the AI image. Okay, so when you use the AI image, what you can do is that use first in the big format. This is the AI image which says unit inside MMG. So this is the AI image. It generally gives the analysis of all 4 images on a single image, and the analysis comes in 2 different ways. At the bottom, you will see the analysis on the breast density by AI. Like in this breast density is given score B. If you ask me subjectively, probably I would have put this as breast density C. But according to AI, this breast, the AI has decided to give an density B, right? Many of you might also would have thought this as density B. And this is what exactly is the difference, that there are inter-reader differences in the breast density assessment, or even the same reader when reads the same mammogram at different occasions, we may analyze the breast density differently. But when you use AI, it's going to be a unique breast density for every time you read the case. And that is what harmonizes the breast density findings. Okay. So you look at the breast density, and the next most important is the breast cancer risk detected by AI. And here it says low for the right breast, low for the left breast. It means that according to AI thinks that there is low risk for cancer, and it has not detected any abnormal finding on these 4 standard images. You may not agree. It may be that AI may sometimes miss the cancer. So you don't have to agree with it completely. But remember that if AI shows a positive finding, go and review those areas very diligently, because sometimes it may be that there are small things which may have been missed by us, and AI helps to highlight those images and brings our attention to those cases. Okay. So I would say, make up your mind, go through the 4 images, put down your findings, and then after adding the AI input, decide and add your remark whether it has changed your findings or whether you agree with AI or you don't agree with AI, because this is going to help you in future to see how AI is working for you. Okay. So these are the all the images which you are supposed to go through. And let me show you one more case. Okay. So let's go through the next case, and that is case number 2. All right. So one more, I'll show you one more case, and again, select that case, go into diagnostic viewer. Some people may also want to click multiple cases and open the diagnostic viewer. What happens by doing this, that you are going to start having the cases loaded here, and one by one you can quickly go through the cases, saving your time. This definitely is very useful, but at the same time, sometimes it may confuse you and you might misread the reports with a different number. So if you're not very sure, open one by one. If you think that you can manage, this is case number 2, case number 5, case number 6, and case number here, it is in yellow. So definitely this is a same case which I have put later on as case 6 prior. Okay. So case 2, 5, and 6 I've opened together. But now first I'm just going to open case number 2, right? So case number 2, I'm going through the same case in the same way. First go through the 4 images. So bring them together, go through the images together. For zooming, I click on right and left on the mouse button together. And I really don't want these annotations obscuring my field. So I'm going to remove them. And now I'm going to have a quick overview of the 4 images. Okay. I see that it is quite extremely dense breast parenchyma to my eyes. There are a lot of benign calcifications. And yes, do I see some abnormal findings? I'm sure all of you are finding an abnormal thing in the right breast. Once you have reviewed these images, go to protocol 2. Now you have 2 images. Make it big enough. I always would remind you again and again, you should digitally zoom every single image, especially because when you want to look for small areas of microcalcification or subtle architectural distortion, that is going to save you. Okay. So now again, go from right, left, right, left. And if you find some abnormal feature, jot it down for you. Okay. So this looks like benign findings. Next, I'm going to go over MLO views. Again, same thing. Start from top. Don't look at something which is obviously looking at you. Start from top to bottom very systematically. Go through the entire case and then put your findings. Satisfaction of search is one of the biggest hurdle in a breast imager's mind, because if that happens, you will miss a lot of cancers in their extensions, basically. Okay. So just because you see something very obvious staring at you, don't think that you have found the abnormal findings and you don't need to further analyze the images properly. There may be something in the different part of the breast. There may be something in the opposite part of the breast. So don't ever take shortcuts. Okay. So once you have gone through all 4 images, put down your findings, and now take help of AI. Okay, so now I'm going to put the AI, and AI here shows you very, very obviously it's a dense breast C density according to AI. And AI says that in the right breast, it has found an abnormal finding with 90%, 98% risk of cancer. So AI strongly feels that there is something in the right breast, and you must look at this area properly, because AI thinks that there is a chance of, very high chance of cancer in this part of the breast. Okay, so look at this area. Probably, I'm sure all of you have found this finding, and then see if AI has helped you, or you agree with AI, or you don't agree with AI. Okay, this is called heat map. So AI gives this heat map where the red color says a very high or very strong risk of cancer, and as it becomes lighter, green and yellow and blue, it becomes that the chance of cancer or the risk of cancer provided or assessed by AI is low. And it also gives a percentage score. So both are heat map and percentage score, both are related to each other. Okay, so this is how you're going to go through all the cases one by one. So once you have finished going through folder number 1, get the details on set number set 2, again put here, enter the test ID, and then you will have access to next set, which again are going to give you access to 15 more cases. So in next 1 week, go through test set 1 and test set 2. They both, these sets will be discussed with you all on coming Saturday on 3rd June in our first live session by Dr. Merritt and Dr. Teresa. And I will be giving a talk on approach to mammogram in the beginning. And at the end, we will also have a talk on AI in breast imaging by Dr. Teresa. When you're going through these cases, remember to put down your findings. And when we discuss the cases, sit with that notebook, or sit with that note where you have put down your findings or your queries, and get them sorted out well during the live session. And that is the best way of making the best during this session. Okay, so that's all about our introduction to the bootcamp, and also how to use the platform. If you face any difficulty, do reach out to our team. They will be there to help you in the beginning, to help you get familiarized with the platform. But it is not a difficult thing. I've seen most of the people just by going through 3 or 4 or 5 cases. When you use the tools, they're very, very easy tools. And what we require generally is only Zoom, pan, contrast, then F5 for resetting, remove the annotations. So some of the basic tools. There are also tools like size and all available, which generally we don't need to use at this time. So you can use them anyhow if you need it. But I'll see you next Saturday in the first live session. Enjoy the bootcamp, and be sincere over next 1 month, and follow the instructions when we send you the folders. So next 2 weeks, go through the first 2 sets of cases, and keep your notes ready during the live sessions to get your doubts clarified. Okay, so see you and have a good weekend this weekend, and a good learning journey of learning together over next 1 month of bootcamp. Take care.